Black moms and babies are more likely to die from pregnancy-related complications than any other race. It's the subject of our brand new documentary, Critical Term, which premiered last night right here on WRAL.
We're also focused on the people trying to save mothers and babies. Investigative documentary reporter Cristin Severance explains how doulas are a big part of the solution.
I'll put my hand on my stomach and I'll talk to him.
We met Raven Marshall at 34 weeks pregnant.
And I'm just really ready to meet him.
Mixed in with that excitement was fear. Raven knows the statistics. Black moms are 3 times more likely to die from pregnancy-related causes, according to the CDC. And black babies have 2 times the chance of dying before they turn 1 in North Carolina.
I had a friend lose twins, and that made me scared. I had another friend lose one of them, one baby.
We investigated the maternal and infant health crisis in our latest WRAL doc, Critical Term. Programs like the Alliance of Black Doulas for Black Mamas are trying to stop these deaths. A partnership between UNC, Duke, and Vanderbilt trains doulas for free and pairs them with families for free. A doula is a coach for a mom, there for her pregnancy, the birth, and after. All of these women are part of the program. That's Raven in the front row. Chantel Shirls is her doula.
Moms, this is for you. Please stand up if you feel like you weren't heard by a healthcare provider, you were dismissed, or you weren't listened to. Okay.
Experts say that's a big part of why this is happening. Something Raven experienced recently.
I was really scared, and it's like I couldn't catch my breath.
First, she went to urgent care. They couldn't see her. She went to the hospital, told them what was happening, and waited for 5 hours.
They told me they had like 10 more people in front of me, and if a trauma patient came in, they would be seen before me too. So at that point, I'm like, okay, so they're not taking me serious. I need to go somewhere else.
She went to a second hospital. They did tests, but her doula Chantal was still concerned. She called nurse midwife Venus Standard at UNC, who trains the doulas.
But I'm like, I need help. I have a mom. She's been to 2 hospitals. She's still not feeling well. Her breathing, she's worried about her baby. He's not moving as much. She's swollen.
Based on those symptoms, Venus was worried about blood clots. She sent Raven to the UNC Family Clinic, where they did a long list of tests and monitored her. She's okay. But all 3 women said this happens far too often. Black moms are ignored by providers. They say doulas are helping to make sure that doesn't happen.
It was amazing. She was there every step of the way.
We're making sure that we are being heard now and that these moms have somebody there.
Cristin Severance, WRAL News.
We do have an update for you, some great news to share. Raven just gave birth to her baby, a little boy named Reggie. Look how cute. That's Raven, Reggie, and her doula, Chantal, in the picture. Raven said she could not imagine going through any of this without her doula. And a reminder, you can watch the entire Critical Term documentary on WRAL.com or WRAL's YouTube channel.